When you discharge a patient, we know that most people do not read printed discharge instructions, and the literature tells us that often patients do not understand their diagnosis and plan, and this is even true for patients of high socioeconomic status. The best method, according to literature, is to have a verbal discussion with the patient to document that discussion. We discussed our system with a malpractice attorney and explained how we wanted to do this, and they were very much in favor of it and thought it was a very good idea. So when you're discharging a patient, we have a discharge checklist. This gives a structured, reproducible way to talk to patients about their discharge. You simply click on discharge checklist, and there's a series of questions about diagnosis explained, summary of all labs and x-rays with results, what they're supposed to do as aftercare instructions, specific follow-up, and asking the question if they asking the patient if they understood or have additional questions. At the time of discharge, when you have this discussion, if you click on the audio icon button, you will get this green banner across the top saying that audio is recording. You run through this systematic approach about diagnosis, labs, x-rays, aftercare, follow-up, and questions with the patient, all while this is recording. When you're finished having the discussion and all questions have been answered, click the microphone icon again, and the recording will stop. You can put a comment if you would like, although that's not required, and then you click Save. Now that audio will be available to the patient after discharge using a system called Box for Healthcare. This is a HIPAA approved or HIPAA compliant system. The patients will get an email allowing them to create a username and login, which will give them access to the audio recording as well as the entire record of their visit. So for both patient care, so that they can listen to this again and give us our best opportunity for understanding, as well as what's prudent from a medical legal standpoint, it's best to record that discussion and make it a permanent part of the record. We expect all of our physicians to use this as much as possible. If you forget at the time when you discharge the patient, you can always do an audio discussion just explaining the diagnosis without the interaction with the patient, and that will still be part of the record and made available to the patient.